avoiding costly unnecessary treatments, and reducing barriers to high-value care for specific conditions. So how do you keep people with very complex medical conditions healthier? And our interpretation of this value-based insurance design is built into our health plans. It's our chronic illness support program. We're going to offer additional help to members with certain chronic medical conditions that can be managed better. The idea behind this is for high blood pressure, hypertension. This is for 2014. It will be these 4 conditions: high blood pressure, hypertension, diabetes, asthma, and then COPD or emphysema. People are going to save money through lower out-of-pocket costs when they get medically necessary services from a plan provider. So if not all of our plans carry this chronic illness support program, of our 7 individual plans, 5 of them do. But if I have diabetes, the idea behind this is I'm going to have my primary care visits that are focused on my diabetes, not if I go in for an ear infection. My primary care visits will go to 0. My generic drugs for my diabetes will go to 0. And there's a lot of information about this on our website. But the idea behind it is really, how do I, if I have this chronic condition, how can I be kept healthier by going to my primary care physician, getting the care I need up front, making sure I really do take my medications, and that I'm relying on my primary care physician to give me a lot of information about that, quarterback my care, so that I can avoid some of the really difficult outcomes down the road that go with those conditions, and both the health outcomes and the financial outcomes, which impact the individuals who have those chronic conditions and impact other people in the health system. So we talked about a number of these things. Again, our unrestricted broad provider network, members having a voice, transparent and nonprofit. And what the plans look like, this is all on our website, so the level of detail, as we're all educating ourselves and coming up with sort of the glossary or the terminology around healthcare, this is just some information, and you can look through this. If people are interested in the PowerPoint presentation, I'm happy to take your name and your email, and I can send this on to you. Actually, Adweej has this as well.
Yeah, everything's going to be online.
Oh, it is? Okay, great. So, but to really start thinking about, okay, when I purchase a plan, I'm going to think about how I use my health care. So do I go a lot, and therefore I'm going to have a lot of copays? Or do I want to make sure that my deductible is higher or lower? The amount that I'm going to have to pay before any benefits are paid, except for those preventive health services? Do I want a coinsurance that is higher or lower? And that's going to be, all those things are going to figure into how your premiums are. So if you want some things that are going to end up costing you less as you go, you're going to likely pay a higher premium for it along the way. Do remember that most preventive services are included at no cost to you. And again, go to that healthcare.gov site and look at what's included in preventive services. And those will be for all qualified health plans. Okay? And then this is, and I do have some of these down front if people are interested, these are our 7 plans. They are, this slide is actually almost identical to this on our website. And you can really delve into what is actually covered on each one of these plans right below this chart on our website. If you go to www.mainoptions, main with an E, options with an S.org, you can go and hit the tab that says Compare Plans, and it will bring up this information. It will also on the bottom have a glossary of terms that you can look through, and it will also have the summary of benefits and coverage. It's about an 8-page document for each of the plans that really walks through what's